Hey friends, it's Kimmy D here, your nursing bestie, and in today's video I'm going to be talking about medication cart etiquette. So basically, why it's so important to have medication cart etiquette, because sometimes, especially if you are new, even if you are a veteran nurse, you've been working on the floor for a long time, people from pharmacy, they would come up to the floor and they would check your cart. So you are responsible for the cart. And you know, I don't want anybody to report you, for you to get in trouble. That depends on the the nursing home, really. Some nursing homes are a little bit more lenient, but even if you are an agency nurse, once you take that key, when you relieve a nurse, you are responsible for that cart. And also, when you are giving meds, if your med cart is properly aligned, if your med cart is properly organized, it will reduce a lot of trouble, a lot of stress, and all that things. My first tip is for medication cart etiquette is to keep your medication cart door locked at all times and have your key in your pocket. You guys know that that is a very important rule. Sometimes we have this tendency to, we're giving meds, we're rushing back and forth, and then we forget to lock our key. There are some people who forget to do that, and I understand, but you cannot forget to do that. Number one, somebody can have easy access to your narcotic box, and there goes your license. And number two, a supervisor can walk by and be like, oh, so you have your medication key, you have your medication door open. I know some nurses, they leave it open because they're at a certain distance and then they could quickly peek. They have vision, like they could see, they're in the patient's room but they could see their med card, so they quickly, you know, they're like, oh, I'm just leaving it unopened because it's like a nuisance to them. But do not do that, because a supervisor can come out of nowhere and you don't want that to happen, or a family member can come out of nowhere. You never know who's walking in the halls, who's ready to put their hands in your cart. In the beginning of the shift, make sure that you guys ask the nurse, especially if you're a floating nurse, which key opens the medication cart and which key opens the narcotic box within the medication cart, because those two keys are going to be your most important keys, okay? So you're gonna want to make sure you know that, because let's say you're in the middle of the shift, you're rushing, especially if you're working 3 to 11 or 7 to 3, you're rushing. Let's say a patient is being combative and you need to give them Ativan ASAP, okay? What are you gonna do, you know? And you have to go inside your narcotic box and then you're fumbling around with keys. Like, no. That's why you have to have your keys in hand so you can open it real quick. If somebody's in pain, you can open it real quick, you know? And it makes the medication process easier, giving medication easier. So I always lock it when I'm about to give my patient medication, and I know that which key opens the medication door key and which key opens the narcotic within the medication door key. Now, some nursing homes, what they do is that they'll take a white tape and they'll mark it. If they're gonna be like, no, don't do that, you can put your own tape on the key, and if they're so strict and somebody's gonna give an issue, just remove the tape from the key. So usually they would mark the medication door key as white, and usually the narcotic would be yellow or orange or something like that. Alright, so we're gonna go over what you should have on your medication cart. We're gonna go from top to bottom, okay? So on top of your medication cart, what I like to do is that I like to first put a sterile drape on it, because of course at the end of your shift, when you give the other nurse your key, you want to make sure your medication cart is clean, or else they will talk about you and it's not a good look for you as a nurse. So I do put the sterile drape down, so just in case anything falls, like a Prostat or heavy liquid, like it fell on the paper, everything is on the paper, all the dirt is on the paper, so at the end of the shift I could just crumple it up, put it in the garbage, and I'm done. I don't have to do no scrubbing the cart because my sterile drape was on it. You're going to have your pill crusher, of course. Some people use the Silent Night, K-N-I-G-H-T, or some people use the one that makes noise, whatever. You're gonna have your pill crusher. And then another thing you're gonna want to do is you're gonna want to make sure that your cups are stacked. Some nurses are nice enough to stack their cups for you so that when you come in you have a fresh cup, but some nurses don't. My opinion, don't come to them and say, why didn't you stack it? Just, you know what? Just take the initiative and stack your own cups, stack your regular drinking cups, stack your medication cups, stack your spoons inside the spoon little cup inside so that it's ready to go. Because during your shift, you're not gonna have time to run back and forth to stack everything up, okay? Also, usually your applesauce would be in there for patients who has crushed. So usually you would crush the medication with your pill crusher that's on top of the medication cart, and you would mix it in with the applesauce that's also on top of your medication cart. We also have our water pitcher. Usually our water pitcher is dated and labeled, water and labeled. Make sure you label your water because some supervisors are very strict. If you don't have it labeled, they get crazy, okay? Especially if state is coming, like they usually want those things labeled. They also want the applesauce to be labeled, but usually the kitchen, when it comes up from the kitchen, it's usually pre-labeled. Thickened water. Sometimes it would be inside the cart, but usually it's on top of the cart. So usually you would have your regular water and your thickened water for residents who can't swallow regular water. This is juice. Sometimes, depending on the facility, you would have juice on top of your cart as well for residents who have to have their juice. And trust me, there are residents who have to have their juice. They're like, I'm not taking my meds unless I have my juice. So if you have your juice handy, boom, boom, bam, give it to them. And next, some people put Ensure on top of their cart. I really don't like to put Ensure on top of my cart. I'd rather just like take it from the tray and like just give it out if I have to. Sometimes your CNAs are nice enough to give them out the Ensures for you, even though it's a nurse's job, depending on each nursing facility. But yeah, sometimes you would have your Ensures on top of your cart so that while you give medication, you just give your Ensure and then you're done. And on top of your cart also you have your straws as well. So just in case somebody needs a straw, you just quickly give it to them if they can't drink their drink like from a regular cup, they would put a straw. Second drawer, we're going to have our OTC medication, over-the-counter medication. So you have your aspirin, you have your ibuprofen, you have your Tylenol, you have, you know, all things, your Prozac, okay? Your Prozac's in there. And sometimes if you can't find a medicine, if you're looking at a patient who has a certain medication and you can't find it in the second drawer, sometimes it's in the first drawer. Like there are some medications that they give in a little packet, like, you know, if you ever saw Prozac, like they give it a little packet. Sometimes look in the first drawer before you ask somebody, oh, I can't find this medication. Sometimes it's in a little flat, very flat packet. I can't explain it, but it's like very flat. Sometimes it would be in the first drawer. So make sure you look in the first drawer. And the first drawer is very flat. It's not really steep. It's really flat. Usually you have your eye drops in there too. Make sure those are labeled, and make sure your OTC medications are labeled. What I mean by labeled, make sure they have a date on them. Okay, so you have your eye drops. Usually you have your diabetes tray, I like to call it. Basically you have your finger stick strips. Open the finger stick strips and make sure you have enough finger stick strips for your shift. If there is not enough and you are new, make sure you ask the nurse who you just relieved, oh, do you know where I can find more finger stick strips? Because the worst thing is if you're having a very hectic day and you can't find any finger stick strips, now you gotta go on a wild goose chase to go find the finger stick strips. You're also gonna wanna have finger prickers, I don't know how you call it, the thing that you prick your finger and then you squeeze it to get blood out. You're gonna want a lot of that. And usually you have your glucometer, your machine to test the patient's blood sugar, of course. On top of your medication cart, you usually have like a hand sanitizer or lotion and a lotion. If they don't provide a hand sanitizer or a lotion, make sure you keep some in your pocket because that's very important, because you're going to be washing your hands all the time and you're going to want to sanitize your hands often, of course. I also keep a blank sheet of paper like this, like computer paper. You can just go get your computer paper or your nursing notebook, especially if you're first starting, and I leave the blank sheet of paper on top of my medication cart. I don't use the nursing notebook anymore because I'm pretty familiar with my nursing facility. But if somebody tells me something real quick, like, oh, Kimberly, don't forget to do this, like I would just quickly write down what they told me, because sometimes when you're in the middle of giving meds, you're not going to remember what they told you, but you're still held responsible for whatever that person told you. So if you quickly write it down, it'll be better. And also your blood pressure, your medication worksheet, usually that consists of all the patient's names. Especially if you are new, make sure you have a list of all the patient's names so that when you're giving medication you can quickly like check it off, and then you can also write their blood pressure for people who you are required to take their blood pressure for. Okay, so inside the diabetes little tray, there's also alcohol pads in them. So in the second drawer, we have our medications. Make sure your medications are stacked in neatly. I don't care how much in a rush you are, you have to make sure it's stacked in neatly. And I'm going to tell you why. Because, and I've done this before by accident. So one day I was like giving medication real quickly, and then my blister pack was out, and I just quickly closed it. Like it was uneven. I can't explain it, but it wasn't neatly stacked, and I just closed it because I was trying to rush and give meds. But that didn't work for my favor. That actually set my work back, because when I went to open it, I couldn't open the cart, and basically, long story short, maintenance had to come and they had to put their hand in. They had to do so much things just to get that medication, just to get that drawer to open. So you may think you're doing yourself a favor, but you're not doing yourself a favor, because you can be putting yourself back actually. Also, on the second drawer, they usually keep, some nursing homes, they keep their gloves on the side or inside of the cart in the second drawer, and they keep like insulin syringes sometimes in the second drawer. Like they would have a little cup and they put insulin syringes. Sometimes they have IV flushes like saline and heparin that you would find on the sides. So those are things that you would find on the sides of the second drawer. So real quick, I forgot to add, when you guys have your like medication worksheet with the list of the patient's name, make sure it's always face down, because if state comes or if a nurse supervisor comes, if they see it face up, they're gonna be like, you're not respecting the patient's privacy. That's HIPAA. So make sure it's face down, you know. And also, when you are giving meds, if you are using a book or if you're using a computer, if you're using a computer, make sure you minus it. Like you click the minus sign when you're stepping away from your medication cart. So for HIPAA, and if you are using a book, make sure you close it. Like, of course, mark your place, but close it, because that is also HIPAA. Okay, so your third drawer is gonna be basically everything liquid. I'm talking Prostat, I'm talking iron, I'm talking all your liquid medications is gonna be in your third drawer. And you know, those can get really messy and sticky, so just like be careful with that, and that's just a warning. So that's gonna be in your third drawer. And in your last drawer, usually you have extra little things, like extra little antibiotics. Like usually if you are supposed to hang an IV antibiotic, sometimes the nurses will leave the antibiotics in the last drawer so you can use, if it's not perishable. Of course, if the antibiotic is to be stored in the refrigerator, that's where you will find it. So usually that will be in it, and usually extra medications will be down there, or sometimes it would be in the second drawer also. But just make sure you check with your facility, like the nurse who you're relieving, that where are the extra medications, because sometimes if you're giving a patient medication, if it's not in their room number, usually it's in the bottom drawer. Usually they keep medication in the bottom drawer. Usually it's in the last drawer. They will keep extra medications there. So before you go and write your medication down as, oh, I'm gonna have to refill Cozar, or you click on the computer, how I do it, to refill, before you try to refill a medication, check in the bottom drawer to make sure that the medication is not in the bottom, because sometimes they keep the extra medications in the bottom until the ones on top finish, and then they replace it with the ones on the bottom. So usually when the person from the pharmacy comes, it's usually somebody who comes and delivers the medication. Usually they come and they give you their medication. You have to sign. Make sure you check and make sure that the medication that you're receiving matches what's on the paper, and then you'll sign and they'll give you the medication. Usually you put those medications on the bottom, okay? If you guys have any question of that, I don't know if I explained it too well, just leave it down below and I will explain to you what I'm talking about. Some last minute tips about medication carts is make sure you keep it clean. I know it's hard to, but people look at that, especially if you're new. I know it could be hard to keep it clean because you're constantly giving meds, you're running back and forth, you have to quickly do this, quickly do that, but try to keep it clean. Try to keep it clean as possible, just clean as you go. Don't leave everything spattered out, but definitely keep it clean before you go to break, because people can walk by and be like, ooh, whose medication cart is that? Oh, she's on break. Look how she leave her medication cart. So people judge you on that. So make sure your medication cart is clean while you are on break. So before on your break, make sure you keep it clean. Make sure you can keep it clean when you are about to leave, because the other nurse who's relieving you, they're going to judge you on that too, and people will talk. Make sure you take out your trash that is attached to your medication cart, put in the cart, put in the trash chute. Sometimes the housekeepers are nice enough to replace it for you, and sometimes they won't. So just make sure that trash is out. Also, I'm so sorry guys for the sunlight. Sorry for the sunlight, guys. Yes, also tips for you. When you're giving medication, make sure you stand up straight. Sometimes we have a bad habit of going like this because we're looking for meds, but make sure you stand up straight. If you're bending down to get a medication that you need, bend at the knees. Don't bend at the back because your back muscles are so small. So bend at the knees, save your back, save your knees, you're worth it, okay? So thank you guys so much for watching this video. I hope you guys enjoyed it. Don't forget to like, comment, and subscribe, and tell me about your medication cart etiquettes if you have one. And I wish you guys the best of luck in your nursing careers. Bye from your nursing bestie.